Mentions of mental health are often casual and imprecise in everyday conversations, with terms like depression and bipolar being used loosely. This misuse of language can add to the stigma surrounding mental illness, unfairly labeling those who struggle with it as abnormal. Today, we're going to debunk some myths about schizophrenia and provide a clearer understanding of the disorder. If you enjoy our psychology videos, please subscribe to our channel and share it with your friends. Schizophrenia is a complex disorder with symptoms that have been documented as far back as ancient Greece, Egypt, and Rome. However, in those times, medical knowledge was limited, and mental health issues were not well understood or effectively treated. Even in more recent history, there was a lack of understanding about schizophrenia, leading to patients being subjected to cruel and ineffective treatments. The disorder was formally recognized in the late 19th century by psychiatrist Emil Kraepelin, who initially described it as a form of early dementia, grouping it with other intellectual disabilities and senility. It wasn't until 15 years later that schizophrenia was identified as a distinct condition, characterized by 4 main symptoms: autism, flattened affect, ambivalence, and loose associations. In simpler terms, this means a reduced display of emotions, detachment from others, indecisiveness, and disordered thought patterns. Some of the historical treatments for schizophrenia were barbaric and posed serious risks to patients' lives. These included administering barbiturates, inducing comas through glucose deprivation, injecting camphor, electroshock therapy, and even lobotomies. During the eugenics movement, individuals with schizophrenia were also forcibly sterilized, a practice that amounted to torture. None of these methods were effective, and the mortality rates among patients were shockingly high. Modern psychiatry continues to seek answers regarding the triggers of schizophrenia and whether a permanent cure is possible. However, our understanding of this condition has significantly improved, allowing us to dispel many misconceptions. Schizophrenia is a mental disorder characterized by symptoms such as hallucinations, delusions, disordered thinking and behavior, and changes in personality. It is considered an endogenous disease, meaning it originates from internal rather than external causes. This suggests that psychological factors like stress or trauma do not directly cause schizophrenia. Research indicates a strong genetic component, with a child of one affected parent having nearly a 15% chance of inheriting the condition, which increases to 60% with 2 affected parents. Psychiatrists have identified other potential risk factors, including maternal infections during pregnancy, brain injuries, substance abuse, and childhood trauma. According to the World Health Organization, WHO, approximately 24 million people worldwide, roughly 1 in 300, live with schizophrenia. The typical onset of schizophrenia is around age 20, although cases can also occur later in life or during childhood. While we will focus on the adult form, it's important to note that mental health is as important as physical health. There is a common misconception that schizophrenia always involves delusions and hallucinations, which are psychotic symptoms indicating a detachment from reality. However, these symptoms are not universal. Schizophrenia encompasses several subtypes, each with its own set of symptoms and behaviors, depending on the specific disorder. In the simple form of schizophrenia, there are no psychotic features such as hallucinations or delusions, but there is a gradual emergence of odd behavior and a decreased ability to meet societal expectations, leading to reduced overall functioning. Significant personality changes are observed, with the individual losing interest in previous activities and avoiding social interactions. They may become more passive, isolated, and emotionally indifferent, often neglecting personal hygiene and grooming. Common behaviors include wandering tendencies, repetitive stereotyped movements, and long-winded, almost speechifying monologues that are filled with empty rhetoric and formal analogies. Despite the absence of hallucinations, this form of schizophrenia is characterized by disturbed psychological processes and personality deterioration. Other subtypes, such as hebephrenic schizophrenia, marked by childish silliness, and paranoid schizophrenia, do involve psychotic symptoms, including delusions and hallucinations. Hallucinations are false sensory perceptions where a person sees, hears, smells, or feels things that are not actually present. These hallucinations can sometimes be commanding, with voices instructing certain behaviors. Some hallucinations are perceived as being part of the surrounding environment, while others are perceived as being confined to the person's head. It's important to note that hallucinations can occur in conditions other than schizophrenia, such as severe depression. Delusions, another major psychotic symptom, are false yet firmly held beliefs that are wildly illogical, implausible, and divorced from reality. These beliefs are maintained despite evidence to the contrary. Delusions often co-occur with hallucinations and can include persecutory beliefs, such as the belief that people dressed in red are stalking you, accompanied by visions of menacing red-clad figures. Delusions can take different forms, including persecutory, grandiose, or self-blaming types, reflecting various preoccupying themes such as being followed, having a higher status, or deserving punishment, respectively. Like hallucinations, delusions are not exclusive to schizophrenia and can occur in other conditions, such as delusional disorder. Common symptoms present in all subtypes of schizophrenia include emotional blunting or flatness, detachment, hostility, and irritability. Schizophrenia is a condition that can only be treated by psychiatrists using medication. There are numerous drugs available to alleviate symptoms like hallucinations, but there is no universal treatment plan. Finding the right combination of medications for a particular patient can be a lengthy process, sometimes taking years. It's essential for individuals with schizophrenia to receive ongoing medical supervision and adhere to their treatment plans. With professional assistance, remission is achievable, enabling individuals to lead fulfilling and productive lives while managing their illness. In summary, schizophrenia is a genuine neurological disorder and not merely a term for unusual behavior. It presents in various ways, sometimes without the classic symptoms of hallucinations and delusions. While the causes of schizophrenia are complex, our understanding and treatment methods have progressed significantly. With the right support and medication, many patients can thrive, a stark contrast to the inhumane treatments of the past. It's crucial not to trivialize schizophrenia as mere crazy talk, as this attitude is uninformed and contributes to stigma. Let's focus on spreading accurate information rather than perpetuating misconceptions. To summarize what we've learned about schizophrenia, it is a brain disorder that profoundly affects a person's thoughts, emotions, and behaviors. The symptoms can vary widely, with some individuals experiencing terrifying hallucinations and delusions, while others primarily struggle with emotional numbness, social withdrawal, and cognitive difficulties. Each case is unique, and it's important to recognize the complexity of this condition. Certainly, the outdated treatments of the past, such as lobotomies and shock therapy, did not contribute to true recovery for individuals with schizophrenia. If anything, they only exacerbated their suffering. Fortunately, modern medicine has made significant strides in understanding the biological basis of schizophrenia and developing more humane and effective therapies. Today, a range of antipsychotic medications can help manage the most distressing symptoms of schizophrenia, such as visual hallucinations and paranoid delusions. Finding the right dosage and combination of drugs can be a process of trial and error. However, medication alone is not a cure-all. Therapy, social support, and self-care routines are also essential components of treatment. Thankfully, we have moved beyond the barbaric practices of the past, like freak shows and forced sterilization campaigns. The journey to recovery and stability can be lengthy and challenging for those living with this persistent disorder. However, with tailored professional treatment, many individuals can manage their symptoms and live independently in society. They can pursue careers, build relationships, and find personal fulfillment rather than being isolated in asylums. Despite these advancements, the exact causes of schizophrenia remain unclear, and there is no guaranteed method of prevention, especially for those with close relatives affected by the disorder. Genetic factors play a significant role, but environmental influences from prenatal nutrition to childhood experiences may also contribute. Ongoing research continues to explore the complex neurological mechanisms involved. It's crucial to continue destigmatizing schizophrenia and dispelling the misconception that it equates to a depraved, split-personality bogeyman. This outdated media portrayal is far from the reality for most individuals with schizophrenia. While overcoming internal struggles and societal prejudices is undeniably challenging, schizophrenia should not define or limit a person's life. With the right support and treatment, many individuals can manage their condition and live without being constrained by it. The key lies in promoting factual awareness, debunking sensationalized myths, and acknowledging schizophrenia as a legitimate medical condition, not a punchline or a reason to ostracize others as crazy. Showing empathy and open-mindedness can greatly contribute to breaking down these unfair stigmas. It's important to remember that individuals with schizophrenia are human beings facing challenges, not individuals to be mocked or dismissed as hopeless cases. What's truly needed is widespread acceptance and access to care, rather than clinging to archaic attitudes reminiscent of medieval times.